Located along the picturesque coastline of Kenya, Mombasa County is a vibrant and culturally rich region that beckons with a unique blend of history, diversity, and natural beauty. Despite its spectacular views, the burden of untreated illnesses looms heavily.
Hospitali zetu, hasa hospitali za umma, changamoto zipo. Utaenda kwa daktari, unampata daktari vizuri. Kisha mpata daktari, atakuandikia dawa, anakuambia nenda wapi? Nenda kanunua, nenda chemist kanunua dawa. Ni kumaanisha hospitali zetu hazina madawa.
Now we have the Shonda Health Center, which has not yet been open. But I wish the governor was here today to see that big population which has really turned up for the medical services. That shows that we need that Shonda Health Center, which is yet to be open. We want it to be open. And those existing one, Manyata, we need it to be expounded. We need more services. We need more medical personnel. We need more drugs. And even the infrastructure has to be expanded.
Mombasa grapples with a substantial burden of poverty, impeding access to healthcare.
Changamoto ni kwamba tukaenda kwa hospitali, mara nyingi sana tunaandikiwa tukanunue madawa. Kama hospitali hazina ile madawa ambayo hasa imekuwa karibu mwaka mzima imewacha hivyo hivyo. Sasa naona imekiri kidogo, naona itanisumbua baadaye. Ndio nikaamua kuja kutafuta msaada.
A majority of residents find themselves compelled to engage in unconventional employment to fulfill their basic needs, prioritizing putting food on the table over seeking medical care.
Mtu akaenda shule akifukuzwa anaambiwa ashikana na nyanyako ama mamako, mwende mkatafute miti huko, mkate mchome makaa mkalipe huko. Sasa kuangalia hivi miti ni kama tumeimaliza. Sababu hali ya kazi kule ni kama zimepungua. Inahitaji wasomi, na wasomi ni kama ni kidogo.
Furthermore, poverty perpetuates illiteracy, amplifying the challenges and consequences on both healthcare access and education in the region. The M-Pesa Foundation, in partnership with Zuri Health, Lions Sight First Eye Hospital, AMREF, and Gertrude's Children's Hospital, remains dedicated to offering free medical services to underserved communities around Kenya. This 10th camp focused on delivering free screening services for chronic illnesses, distributing free medication, and conducting health education and sensitization programs, among other services, to residents of Likoni constituency. Over 5,000 patients were attended to.
Yeah, we are here today at Consolata Primary School, and we are here today because of certain organizations who have come together in partnership to have a free medical camp for the residents of Likoni constituency. I want to appreciate M-Pesa Foundation, Zuri Health Services, Gertrude Hospital, AMREF, and there is Lion's Eyes. And I want to say I really appreciate. You can just see the population which has really turned up here today. And it is because people want to have health services.
Mombasa is the second largest city in Kenya with approximately 1.2 million inhabitants. The city has a rapidly growing population, and some areas experience overcrowding, numerous open dump sites, inadequate drainage, stagnant water, and ample breeding sites for mosquitoes. These factors make Mombasa particularly vulnerable to vector-borne and airborne diseases. Apart from malaria, the chikungunya outbreak in 2018 presented new challenges to Mombasa County's health sector.
Malaria haikosekani. Alafu ugonjwa wa 4 unaitwa chikungunya. Ona haya magonjwa hayakosekani ukanda huu wa pwani. Chikungunya ni ugonjwa ambao unatwanga viungo vya mwili, inaponda. Ukienda inaleta symptoms kama malaria. Lakini sio malaria.
Although the World Health Organization provided support to control the illness, additional measures need to be implemented for effective management of the disease in the future. This camp not only leverages technology in data collection, but also in the diagnosis of illnesses such as tuberculosis. Given the endemic nature of tuberculosis in Mombasa County, individuals experiencing chest pains were offered X-ray imaging services. Nevertheless, a more in-depth assessment was conducted using TB detection technology.
TrueNut is a DNA test which involves detection of the DNA of bacterium tuberculosis. Then TrueNut test is a semi-automatic, means it requires some manuals like preparation of the specimens, and it informs two different machines where we have the TruePrep and TrueLab. Here in the TruePrep, it's where we do extraction of the DNA, which takes like 20 minutes. Then after extraction, we get the hair roots. Then the hair roots, we transfer it to the TrueLab for DNA detection, which takes like 40 minutes. Mombasa, as far as tuberculosis is concerned, the rate is high. As you compare to other counties, in Mombasa, tuberculosis is very high, and especially here in Likoni and Changamwe, na Jomvu. Those are the three sub-counties where the tuberculosis is very high.
Other services offered include dental and eye screening. Over 800 patients received eye screening services and nearly 3,000 patients received dental screening services. Out of the patients screened for eye conditions, 65 patients were scheduled for cataract surgery, with early cataract identified in another 16 patients. Reading glasses were provided as necessary, and individuals needing further assessment were referred.
Kwa matatizo ya macho, wajua daktari kama unaumwa, daktari ndio anakuangalia. Na kwa kuwa daktari ameniangalia, nimepitia vile hatua zile ambazo amenieleza kufikia mahali ambapo nimefika, na nimepata kufika kwa daktari, amenipatia dawa, na kwa sasa hivi nimepewa dawa na nimepata na macho mengine ya kuona. Sasa hivi nafikiri hatua ambayo nitachukua ni baada ya kuwa nimetumia yale madawa ndio nitajua itakuwa imefikia wapi, lakini kwa sasa huduma imekuwa sawa.
Kwa majina yangu naitwa Emmanuel Charokalu, na nikaamua kuja kuangaliwa kama nitapata matibabu ya shida ya jicho. Nashukuru nimeangaliwa, nikaambiwa kwamba nahitaji operation.
Dental problems continue to burden low-income communities. The high cost of treatments, lack of insurance coverage, or limited access to affordable dental clinics prevent underserved communities from accessing dental care. During this camp, over 1,200 dental extractions were performed. 16% of the patients presented with tooth sensitivity, with others diagnosed with various conditions, including gingivitis, retained roots, and pulpitis. The impact of these interventions extends beyond mere treatments, positively influencing the overall health and well-being of the community. Children's health was not an exception during this medical camp. 27% of the attendees comprised of children, and 39% of them were under 5 years. Gertrude's Children's Hospital offered pediatric care such as dermatology and screening for respiratory and gastrointestinal tract diseases. Sexual and reproductive health is an essential part of overall health and well-being. Empowering communities in this aspect is vital, given its profound impact on individuals, their families, and the broader community. Partnering with AMREF and the county government of Mombasa ensured this camp provided free screening for fistula, cervical and breast cancer, and family planning services.
Huduma ya yani matibabu yote yako hapa kwa kifupi. Na nikapendezwa na kuja kwa huduma ya family planning. Manake saa hii uchumi ni mgumu, mpaka ujipange. Usipojipanga utapangwa na maisha. Ningependa jamii yenye kupanga uzazi, manake ukipanga kama uwezi kuzaa mtoto wa miezi mitatu na huku ama hata hajafikia mwaka mmoja uko na mimba ya miezi 6. Huyo mtoto utakuwa afya yake si afya ya mtoto wa kawaida. Ni vizuri kujipanga, kupanga uzazi. Manake sasa ukilea mtoto kwa njia ya kujipanga, watoto wataenda shule vizuri, utakuwa na afya bora, utakuwa na jamii yenye furaha. Unaona vitu kama hizo.
Climate and economic changes in the world continue to impact the health and well-being of people. However, People who already experience multidimensional poverty with a disparity in social, political, economic, historical, and environmental contexts are more vulnerable to this impact. The M-Pesa Foundation, in collaboration with its partners, persists in making collaborative efforts to ensure that quality healthcare services reach underserved communities irrespective of any changes.
And for us, tutapatana hata na nyinyi, mimi nikiwa kama member of parliament where I can give NHIF to my people, I will partner with you. Tukiwa tumepatiana NHIF, today hata naona M-Pesa Foundation wamepatiana some few beneficiaries, wale ambao wako na magonjwa yale magumu zaidi mazito. Also they are going to have NHIF so that at least wanaweza kupata service without paying anything.
La mwisho la kueleza ni kutoa shukrani tu kwa huduma ambazo mnatuletea, na ninaomba in future mzidi kutuletea huduma kama hizi ili tumkae pamoja nasi sisi wananchi. Hapo ndio njia moja kujua kwamba kuna mashirika ambayo yanatujali sisi kama wananchi.